Hello everyone. Welcome to Dental Digest with the Study Boards. In today's episode, we will cover viral infections that has been extensively tested in the exams. Now it's a topic for oral pathology and we will be talking about human papillomavirus. Now in this session, we will discuss different types of HPV, how it is transmitted, conditions associated with HPV, the symptoms, diagnostic methods, vaccination and prevention, and finally, some available treatments. Now let's begin by looking at the various types of HPV. Now HPV is not just one virus, but it's a group of over 200 related viruses. Now these are broadly classified into two main categories, low risk and high risk types. Now low risk types such as HPV-6 and HPV-11 causes conditions like genital warts. And high-risk types such as HPV-16 and HPV-18, they are associated with several cancers including cervical cancer, throat cancer, and anal cancer. And these are exam questions, so pay attention to this. Let's talk about the transmission now. Now HPV is primarily transmitted through direct skin-to-skin contact. And most commonly, it spreads through vaginal, anal, or oral sex with the infected partner. And in rare cases, a mother can pass HPV to her baby during childbirth, which may cause respiratory papillomatosis, a condition where warts grow in the infant's airway. Now let's talk about the symptoms. Now, HPV infections are often asymptomatic, meaning most of the people don't even realize that they're infected. Now, for low-risk HPV types, genital warts are most common symptoms, and these warts can appear on genitals, on anus, or even inside the mouth and throat. And the high-risk HPV infections may not show immediate symptoms, but they can lead to precancerous lesions, and over time, they can progress to cancer, particularly in the cervix, throat, or anus. Now, there are two conditions which are associated with HPV. Let's talk about the first one, that is verruca vulgaris. Now, verruca vulgaris is also known as common warts, and it is caused by HPV types 1, 2, and 4. And these warts typically appear on hands and feet, and they have a rough, raised surface. And now, while these are generally painless, they can sometimes cause discomfort. Now, next one is condyloma acuminatum. That is the second one that I had talked about. Or you can call them as genital warts, which is caused by HPV type 6 and 11. Very important. And the regions have a characteristic soft and cauliflower-like appearance. This is an exam question. And they are spreading through sexual contact, or they can be even more concerning due to their location and potential to cause discomfort or stress. Now, treatment for both these conditions involve removal of these warts through medications or procedures like cryotherapy. Now, the next part is diagnosis of HPV, which is usually done through physical examination of these warts or lesions. Now, for women, a pap smear can detect abnormal cervical cells, which may be caused by HPV. Then HPV DNA testing is also available and can identify high-risk strains in both men and women. So it is very essential to detect the high-risk HPV early to prevent progression to cancer. Now comes the vaccination part. The most commonly used vaccine, that is Gardasil 9, it protects against 9 types of HPV, including your high-risk types HPV 16 and 18. Now a very important question is, who exactly should get this HPV vaccine? Now, for us to understand this part, we have to understand the definition of preteens. Now, preteens are children who are generally aged between 9 to 12. And this stage, it precedes adolescence and is a time of significant growth and development. Now, there are two main groups that we should think about. The first one is 9 to 12 years of age, that is preteens category. Now, the ideal age for HPV vaccination is 11 to 12 years, but the vaccination can start as early as 9 years. Now, the second category is the age between 15 and 26 years. Now, teens and young adults up to the age of 26, they should get vaccinated if they missed earlier opportunities. Then we must be thinking about what is the importance of this HPV vaccine. Now, for preteens, all the preteens should be getting vaccinated to protect against HPV-related cancers in the future. And for teens and young adults, like those who did not start or finish the vaccine series by the age of 26, they should also get vaccinated. Now, the next question that is being asked is, what is the number of dosage that is being given? Now, 2 doses are required if your first dose is given before your 15th birthday, and 3 doses are needed if starting the series at the ages of 15 through 26. This is very important. Now, there are some special cases as well. In case there is an incomplete dosage that has been given for 9 to 14 years, then a third dose is needed if these 2 doses were given less than 5 months apart. Now, those individuals who are having weakened immune system, like people in the age of 9 through 26, they should also get 3 doses. Now, another question that they can ask you is, what is the age limit? Now, anyone who is above the age of 26 years, HPV vaccination is generally not recommended for those individuals. Now, the next part is regarding the treatment. Now, there is no cure for HPV itself, but there are treatments for the conditions it causes, like genital warts can be removed through topical medications, cryotherapy, or even surgery. And for the precancerous cervical lesions, procedures like cryotherapy or LEEP, that is called loop electrosurgical excision procedure, can also be used. Now, for cancers caused by HPV, treatment typically involves surgery, radiation therapy, or chemotherapy. So what are the key points that we have talked about? So first of all, we talked about the types of HPV, that is low risk warts or versus high risk cancers. Second is regarding transmission, that is skin to skin contact, oral, vaginal, and sex. Then we have symptoms, which is often asymptomatic, but warts or cancer risk could be talked about. The next one was the conditions discussed, that is verruca vulgaris and condyloma acuminatum. Then we talked about diagnosis, prevention, and treatment, where we talked about how to treat warts and manage the cancer risk. Thank you so much for watching this video. Now, if you enjoyed the video, don't forget to hit that like button and subscribe to the channel for more content. Remember to keep working hard and keep rocking. I'll see you in the next one.